Hi guys, welcome to another Live with Dr. Salemy. Again, my name is Olivia. I'm one of his nurses and his Instagram guru. Today we are talking all about tummy tucks, mini versus extended versus drains and pain management, all of the above. He's even got his whiteboard out, so stay tuned. This is going to be a drawing, interactive, ask questions per usual. You guys bring the Q's and we'll bring the A's. You ready?
How's it going, everybody? Hope everyone's staying safe and not getting too bored out of their mind. We decided in my house for my wife to give me a haircut with the clippers because I can't get into the barber. And
a quarantine cut.
A quarantine cut, yeah. It looks good. It's short and off my ears, so I like that part. Okay, so we thought it'd be fun to talk tummy tucks today. We do a lot of them. Probably doing a tummy tuck. Gosh, almost every day that I operate, we do at least one. Really popular, high satisfaction operation. I got the whiteboard here because I thought I would draw some pictures out after we go through some questions so folks can kind of see how I think about the operation because everybody does it a little bit differently, and I think it's really helpful for folks to see what the surgeon does. And this is something that we do with every consult as well. In person, we'll draw them out and so folks can see what we do. Tummy tucks, we probably do about maybe 200 or 300 a year pretty easily. It's a really popular operation, really designed to remove extra skin, remove extra fat, and tighten up the muscles of the abdomen. And the most common patients are folks who are either have lost a lot of weight from weight loss surgery or just from hard work, diet, and exercise, or moms. For most women, once they've had a pregnancy, the muscles have stretched, there's excess skin and fat, and no matter how hard they work out, no matter how fit they are, how much they watch their diet, they're still going to have that loose muscle and some loose skin. So that's why it works extremely well. We have a lot of photos on our website of before and afters of tummy tucks by themselves, as well as that operation combined with other operations. So for example, what we call a mommy makeover, where we do some surgery for the breast, like an augmentation or a lift or both, and a tummy tuck to really get folks looking their best after having had kids. What I want to do maybe is start by answering some questions as they pop through. Olivia will give me some, and I also have some that have been sent over. And then I want to draw some pictures out. Should we start with the...
Sure.
Cool. So first question is from Achoa Susie. And it's how many hours are in surgery? It's a good question. For me, a tummy tuck can range from about 2 to 3 hours, just kind of depending on how involved it is. Sometimes a little bit quicker, like a mini will be a little bit quicker than that. Extended tummy tucks can take a little bit longer. It just depends on how much work we have to do. Let's talk about drainless. Yeah, let's just jump right into it. So recently we started doing our tummy tucks, what's called a drainless tummy tuck. Basically, for years and years, we put drains into the space where we do the work in the abdomen. And the reason we do that is there's this large space after you release the skin and tighten the muscles, and the body's going to fill that with fluid. The drains help that fluid drain out, helps the skin sit back down, and then we slowly take out the drains over time. The problem is that drains are really annoying. Patients really don't like them, and it doesn't prevent seroma 100% from happening. What's a seroma? Seroma is that fluid that collects there and doesn't get absorbed by the body, and that's what we're trying to avoid. So over the last few years, surgeons have been perfecting these techniques for a drainless tummy tuck, where they're essentially tightening, after they do the surgery, they're actually sitting the skin down on the muscle and and placing what are called progressive tension sutures. So they're sitting the skin down, and as they're sitting it down, they're putting these stitches in on the inside, from the underside of the skin to the muscle, to help sit that skin down and obliterate or take away all that space. And the studies are pretty clear that it really works. It does help prevent seroma. Some studies say it actually is better than drains. So we started doing it, and patients love it. We're getting great results with it. So we're very happy to do that for just about every patient. Every once in a while, there's a patient that we really feel like is going to need a drain in addition to that, but most patients can get away without a drain. Can we do a tummy tuck and a fat injection to the face? Yep, absolutely. We combine the tummy tucks with lots of different procedures. Fat injections, whether it's face, breast, or buttock, like a BBL, we can do them together at the same time, no problem. what's the recovery time? So a little bit depends on the extent of the operation, but in general, I ask patients to plan on a couple of weeks off from work. They're going to feel pretty good in about a week, but really give yourself 2 weeks off from work or any sort of major responsibilities. And then it's 6 weeks before you can do anything you want without any restriction, like working out, running, that kind of thing. What kinds? I'm sorry, I didn't give the. I didn't say who asked the last question. That was from Jennifer Vaughn. The next question is from Through the Portal 3. What kind of patients tend to do better with scarring? Any particular age, race, or body? It's a good question. The short answer is that most patients do really well with scarring, regardless of their ethnicity. Some patients don't, and it's difficult to predict in some cases. That being said, in general, Caucasian patients tend to do pretty darn well with scarring. It's really rare to see what's called a hypertrophic or a really thick, raised, dark scar on a Caucasian patient. The patients who have a slightly higher risk of that are, in my experience, are Asian patients or Latino patients. African American patients I haven't found to have a much different risk than a Caucasian patient for that, interestingly enough. Certainly not with a tummy tuck. So we do a lot of things during surgery and ask folks to do some things after surgery to help reduce the amount of scarring. But every once in a while there's going to be a patient that's going to have a bad scar, a thick scar, and then we have to do some other things down the road to help that.
Back to the drains, someone's asking, would excess weight loss, she's lost 140 pounds, look like? Would that equal drains?
Great question. First of all, congrats on 140 pounds of weight loss. That's amazing. There are some surgeons who will put a drain in on someone just based solely on the surface area of the size. I think it really depends on what we see when we get in there. If someone is a little bit, has a larger surface area just from having lost a lot of weight, it would probably be reasonable to put a drain in addition to putting in the progressive tension sutures. But what's nice about that is when we put those sutures in, and even if you have to have a drain in, the likelihood is that that drain will come out a lot quicker. So we would, in some patients, we probably would put in one just to be on the safe side, but it would probably come out quicker than with a traditional technique.
Another question is, do you know if someone has visceral fat by looking at them, or is it revealed when the patient is open?
Yeah, great question. So I'm going to draw that out. The visceral fat question is really important. Usually I can tell just by an exam that they do have some visceral fat that may affect their final result. If you're wondering what visceral fat is, what we're talking about is the fat that's behind your muscle around your organs. That's not fat that can be dealt with a tummy tuck. That's diet and exercise. And if folks have a lot of that visceral fat compared to very little superficial fat, the fat between the skin and the muscle, then we really want to talk to them about weight loss prior to doing a tummy tuck, because that visceral fat can really affect the final result. Good questions, though. So let's see. Next question is from, let me find, okay. This is from another one from Through the Portal 3. Does liposuction always go hand in hand with tummy tucks? Not always. If someone is, we have a lot of patients who are very, very thin and just have some loose skin and fat. Loose skin and loose muscle and very little excess fat. So it's really not worth their money or their time to do liposuction at the same time. That being said, if someone has some excess fat, especially on their hips or kind of the love handles, it makes sense to do some liposuction at the same time. It just gives them a better overall silhouette and better contour. So we really try to tailor it to the patient and have them go through the operation they need versus kind of a cookie cutter approach to every patient. This is actually a really good question from the birth photographer saying, can I still get a tummy tuck if I have a good 40 pounds to lose and I carry most of it in my tummy area? So what I tell patients with any type of body contouring surgery is that if you're able to lose that extra weight, you're going to lose, in this case, that 40 pounds. It makes a lot of sense to lose the weight first and then do the tummy tuck. One, I think it reduces your risk of having any particular complications. With excess weight, heavier patients have a higher risk of having some type of complication after surgery. I think it gives you a nicer cosmetic result. And also, you don't want to do the tummy tuck and then, knowing you're going to lose another 40 pounds, lose the 40 pounds after the tummy tuck, because it's probably going to loosen things up a bit. So that's one scenario. Now imagine another scenario where a patient has been working hard, has lost a lot of weight, but has a bit of weight that's stubborn and they can't lose it. We'll have a really good conversation about the pros and cons of doing a tummy tuck in that situation. And oftentimes I find patients will do the tummy tuck and then they're able to lose that last little bit a little bit easier. They usually tell me it's because They are able to see the results of their hard work better than they did before. They feel more comfortable working out. They don't have this heavy skin and fat that's kind of difficult to work out in. Some patients even report after a tummy tuck feeling less hungry. They feel more fit. They feel their core is stronger. These are all more anecdotal. So there are some situations where when folks are pretty close to their goal weight but they haven't quite gotten there, that doing a tummy tuck will help them kind of get that last little bit.
Another question is, what are dog ears, and would an extended tummy tuck help with dog ears?
Yes. So dog ears, what we're describing is when we make our incision for the tummy tuck, and I'll draw this out for you, the outer edge of it, there can be some remaining loose skin and fat. Now, why is that? So when we make our incision, we lift the skin and fat up, we tighten the muscles. As we pull the skin down, the more skin you have to pull down and the more you pull it down, there's going to be some excess on the side. So what we do to try to prevent that is we just extend the incision a little bit. That doesn't mean everybody needs what we call an extended tummy tuck. It just means that for some patients we need to extend the incision just a touch to get out that extra skin. So our goal during the surgery is we don't want to leave the operating room seeing those dog ears. We're not doing that. So we extend the incision as much as we can to get out that last little bit so you have a nice smooth contour. Every once in a while somebody has a little bit of excess skin or a little bit of bunching there that doesn't settle with time, and then we can always go back under local anesthetic and deal with that. Another question from Chelsea Kelly saying, what is a mini tummy tuck and who would be a good candidate for it? Okay, this actually leads us really well into kind of how I think about the surgery. So what I want to do is I want to draw out a picture of how we do a regular tummy tuck, how we would do a mini tummy tuck, and then kind of give you a sense of what type of anatomy works for one operation versus another. So let's start with just kind of the regular tummy tucks that we do. So hopefully we can see that okay. Okay, great. Thanks, Olivia. So I'm going to try to draw this out as best I can using some different markers so folks can kind of see what we're talking about. So when we're doing a tummy tuck, we start with an incision. Let's say we're doing a full tummy tuck. We start with an incision that runs low and flat. Now I try to make this incision as low and as flat as I can below the underwear line so that in most swimsuits or underwear it can be hidden. The length of this incision really depends on the patient. So some patients need the incision extended out around their hips. That's and going as far back with them laying on the operating room table. We sometimes refer to that as an extended tummy tuck. Others don't. They just need it kind of going from hip to hip. We also make an incision around the belly button. And through those incisions, this skin and fat that you're seeing, we release that off the underlying muscles. Now those six-pack muscles, which should be, let me see if I can draw these out for you. They should be kind of right next to each other. With each pregnancy, they move apart to make room for the babies. And no matter how hard you work out, they won't come back together. Now that makes women look wider than they actually are from hip to hip. But when we look at them from the side, I'll kind of draw a side picture. Most patients will have some combination of some loose hanging skin, some excess fat, and then this muscle is also quite loose. So we need to deal with that muscle. The way we do that is with a series of sutures that we place to bring those muscles back together in the midline, acting like a corset. And just like a corset, I'm trying to do a couple of things. I'm trying to narrow the waist to give patients better waistline definition. But the other thing we're trying to do, looking at them from the side again, we're trying to flatten that belly. Now, how flat we can get them really depends on the patient. So remember we talked about visceral fat? So some patients have this fat behind the muscle, so not in front of the muscle, but behind it. And if they're carrying a lot of fat there, that will push on this repair, and it kind of bows the abdomen out. It'll still look better than it does now, but it really limits how flat we can get the abdomen. So we try to get folks to lose that weight prior to surgery if possible.
Is this the butt?
Yeah, sorry.
Okay.
But.
Got it.
Sorry, but. Yeah, I think, is that clear?
Yeah.
Hopefully. Okay, sorry if it's not. And then the final step, as we pull down that skin with the fat that's underneath it, and we remove as much of that as we can. That's typically everything from this incision to at least the level of the belly button, sometimes higher. Close that incision, and then this is a really key part. We make a new hole for the belly button to bring the belly button out through a new hole. Do you think maybe you could stand up? Maybe it'll be a little bit easier to see.
Yeah.
I just want to make sure folks can.
From the top?
Yeah, there you go.
Let me just flip.
Let's see you flip. There you go. Is that okay?
Yep.
Cool. So hope that makes sense. So we made that incision, we tighten the muscles, we pull down the skin and fat, we remove as much of that extra skin and fat as we can, close the incision, and then we do several steps to get that belly button looking really good. That's a really key, important part of this operation. It's not an afterthought. So we try as hard as we can to get that belly button looking as beautiful as possible. We, because it is really what the eye sees. If you're wearing a swimsuit or underwear, your eye's going to catch that belly button. So we really want it to look really good. So that is what I would describe as sort of a full tummy tuck. Now, what I want to do is draw a couple different sort of sketches of what the particular anatomy would look like when we would consider a mini versus a full. Does that make sense? Any questions so far on that?
Not yet.
Okay, so I'm spraying, and we'll see if we can make this so folks can see what we're talking about here. All right. So let's say most women, I would say, in my practice, probably 90%, maybe more, of patients really have anatomy that looks like it's going to be served by a full tummy tuck. So that would be anatomy that's sort of like this. So I'll draw this out again. So normal size torso, normal position of the belly button. They have loose skin and muscle. That's basically the whole length of the abdomen from the pubic bone up to the ribs. That's the whole length is loose. So when we look at them from the side, they kind of look, again, that's butt. So they kind of look like this. So then you see this muscle is really loose the whole way, okay? So I would call that, like this would be someone who would do well with a full. But let's say the anatomy looks more like this. So now let's say somebody comes in and usually they have kind of a long, really narrow waist. They have a high belly button, right? I sort of think of like, oftentimes you see women who are kind of like volleyball players, that kind of frame, really long and narrow, high belly button. And when we look at them, really the issue is they have some loose muscle just in the lower portion of the abdomen. Up here is okay. And then when we look at them from the side, again, but when we look at them from the side, it's actually kind of flat or okay at the top, but then right at the bottom you see a little bit of laxity. So the muscle's okay, and then there's a little bit of a pooch there. So those patients are going to do well with a mini. Now what's a mini? A mini, instead of that long incision that goes hip to hip and one around the belly button in a full, in a mini you just have one at the bottom. The advantage of a mini is that it's a smaller operation, a quicker recovery, slightly shorter scar, although maybe not quite as short as people think. It's probably about maybe 2/3 the length of a regular scar, but there's no incision around the belly button. So that's good if you love the way your belly button looks and you don't want to have it touched. But most women who are getting a tummy tuck, they're more like this, and the belly button's really been affected from the pregnancies or from weight changes. So the mini, we make that short incision. We just tighten the muscles just on the lower abdomen only. So you're really only getting tightening from the belly button down. And then we pull and remove just a little bit of skin. Typically, it's just sort of like a little bit of excess right through here. So who does well with this? I see this a lot in women who are really petite, longer torso, high belly button, perhaps have had a C-section after pregnancy, and just have this little bit of extra skin at the bottom of the abdomen. It works great for them. The most important thing I can tell you is this. If you need, did I do that right?
Yep.
Okay, cool. If you need a full, you should get a full. Don't do a mini because you want a shorter scar, because you will be really disappointed with the results if you actually need a full. I tell patients if you need a full and you just don't want it for any reason, and it's okay if you don't want to go through the longer incision and all that, then don't waste your money on surgery because you'll be really disappointed with the result. But I hope that makes sense. Full, mini, and then one other thing just to add to it is, and some folks, they need an extended, and so that is when we extend the incisions around the hips. And folks who really have a lot of loose skin and fat going all the way back around their hips. And in really extreme cases, this is usually in folks who've had weight loss surgery and they lost a lot of weight. It's not enough to just pull the skin down. we also have to pull the skin in. So we're not just pulling like this, we're also pulling in like that. And when we pull in like that, you're going to get gathering of skin and fat in the middle. So then we do an incision kind of up, around, and up like that. And that's called a fleur-de-lis. So you have a long vertical and transverse. That's more rare. So I would say probably 90% of the patients are getting a full, maybe 7-8% are getting a mini, and then a couple of percentage points are getting the fleur-de-lis. In my practice, every practice is different, but that's kind of how we do it. And then one final thing for liposuction, the places that can safely be lipoed are kind of the hips, this kind of sort of love handle area, with either operation. With a full, I get a little bit more nervous up here. We don't want to lipo through here. This can be a little bit dangerous to the blood supply. With a mini, it's a little bit safer because we're not releasing the skin as much, so that's okay there.
Okay, we do have a couple questions.
Yeah.
Why might a patient require that vertical scar, maybe on the full?
Yeah, so that would be somebody who's had massive weight loss, so they have so much extra loose skin and fat that it's not enough just to pull it down. We have to actually pull it down and pull it in from outside to inside. So when you pull it outside to inside, you're going to get all this gathering of skin and fat in the middle, so we want to remove that. So the average patient, average mom, average weight loss patient is not going to need that. And we'll definitely let you know you're not going to wake up with that scar if we haven't talked about it before surgery. But the patients who've lost 150 pounds from a weight loss surgery and have tons of loose hanging skin and fat, we talk about that. And truth be told, most of the time, those patients are fine with that scar because they just want to get as much of that extra skin and fat out as possible.
Maybe not in reference to the fleur-de-lis, but just the small vertical scars. Why?
Oh, the small vertical scar. Great question. Okay, that's a really good question. So let's say somebody, it needs a full tummy tuck, but the belly button's a little bit high. So the belly button's high, but we need to do the full tummy tuck because they have loose muscle above and below. As we're pulling down the skin to remove it, in the skin we're pulling down is the hole in the skin where the belly button used to be. Sometimes patients don't have enough loose skin for that hole to be excised and removed. So as we pull down, we remove as much skin as we can, but we still have that old hole. So in those situations, we close that hole as a straight line. That's really the only choice in that situation, unless we take this incision and instead of putting it really nice and low, moving it up closer to the belly button, which most women don't want because then it's sitting really high. Even with regular underwear, you would be able to see it. So we don't want to do that. And there's definitely patients who would need that. We try our best to talk to everybody about that before. Interestingly, if I think someone needs it or may need it, I tell them pre-op. And then about half the time I'm wrong, they don't need it, which is great. It's a nice surprise if they don't need it, but we tell them if we think they're going to need it.
Is the pooch able to be done with just lipo if it's smaller, or do you lipo with the mini as well?
The pooch? You mean
I think that little drawing up there.
When
they have a good upper abdomen, but maybe just...
Oh, they don't want to... They have a good upper abdomen and they just have a little bit of skin and fat there?
Yeah.
Yeah, so it depends on what we're looking at. If the skin... So liposuction, we're going to talk about that actually next week, so awesome question.
Stay tuned.
Stay tuned for that. But liposuction works best when folks don't have any loose skin. You need the skin to contract down and tighten over the area that we liposuction. So, and I'll draw this real quick so you guys can see this, but we'll be drawing this next week too. So if you're looking at like a cross section of the abdomen, imagine you have, like, let's say this is the muscle layer. Okay, I'm going to show you two different patients. So that's like the muscles of the abdomen. And then let's say this is the fat. Okay. And in one patient, they're super thin. They have just a little bit of fat that's bothering them. And another patient, they have a lot of fat. And then this patient, the skin is nice and tight and good quality. And this patient, it's kind of maybe looser, maybe some stretch marks, maybe some rippling. So when you liposuction this fat, we're relying on this skin in blue to tighten down. You can see it's not going to have to work as hard to tighten down because there's less space it has to sit down on. But here, if the skin is thinner, if there's more loose skin and there's more fat, if you just lipo this and don't remove the skin is going to be lumpy, bumpy, wavy. So in a patient there are certainly women out there who are, I think, wonderfully very lucky and happy that they've had children, but they don't have any loose skin, which is great, so they don't need a tummy tuck. In those patients, we can certainly do some liposuction there, but we really need to have a talk with them about their anatomy and doing picking the best operation for their goals and what their anatomy will allow us to do.
Can you fix a hernia during a tummy tuck?
So you can, it depends on what we're talking about. So I occasionally have patients who have a little belly button hernia, and I tell patients if I come across it during the surgery, I'll fix it for them. It's not a big deal to do that. But if you have a really larger hernia, I urge patients to have a general surgeon fix it for them first, because usually they're going to be putting in some sort of mesh. It's not an operation I do, and we don't want that hernia to recur or to be done kind of only halfway by, we want a general surgeon to really fix it with the mesh so that it heals really well. That way, when we come in and do our tummy tuck, it doesn't affect your results.
And what do you use for pain management?
Great question. So we actually started about a year and a half ago. We started what we call a multimodal or many-step non-narcotic pain management protocol. So we try to get our patients through the operations without using any narcotics. We are happy to give it to them if they need it. But we found, and just full disclosure, we didn't invent this. We're not the only ones that do it. There's a lot of really good surgeons nationwide that do it, and it works extremely well. What we're basically doing is getting their body ready for the operation before surgery with certain medications. During surgery, we're doing a number of things, including putting in a medication called Exparel, which is a long-acting numbing medication, putting it right into the muscle layer, which is really the soreness from this. That's where the soreness comes from. And that Exparel lasts for 3 days, and it works great. And then after surgery, giving them 3 or 4 different types of medication to kind of hit the pain pathway at different points. And what we found is that with this protocol, most of our patients actually don't want or need narcotics. Now, if they need it, we're happy to give it to them, but as you all know, narcotics have side effects like constipation and not feeling like yourself, kind of feeling like woozy. So we try to avoid that. Patients have done extremely well with this protocol.
That's all the questions.
All right. Well, I hope that helps. Full, mini, extended, fleur-de-lis. We'll get into lipo. Next week we're going to do liposuction, fat transfer. Please keep your questions coming. Please, everybody, stay safe. We'll be back operating hopefully soon once the state lifts its ban on it. And we'll love to take care of all of you. Take care.
And plug the free consult.
Oh, yeah. So one other final thing. So, for the month of April, we're doing virtual consults for free. All you got to do is just contact our office, call our office, or email us, and we'll go through the process of setting that up. And in that virtual consult, will also include an in-person consult that we'll do once we're able to see patients again. And it's been great. Folks have some free time. We get a chance to start to meet you and get to know what you're wanting. And a lot of patients want to get surgery scheduled in the summer. So we're getting them all scheduled up and ready to go. So, but we'd love to meet you.
Thank you.
Thanks. See you next week.